Hello, my name is Chris Foister, and I will be doing my presentation on Creutzfeldt-Jakob disease, also known as CJD for short. What causes CJD? CJD is caused by prions. Prions are not bacteria or viruses because they have no nucleic acid or cell organelles. It is a protein that can be found everywhere in your body, but not all of them are harmful. The non-harmful ones are called cellular prion proteins, or PRPC for short, and the infectious prions are called PRPSC, and they are actually misfolded. To this day, the function is not fully understood. We're not sure about any virulence factors or metabolic characteristics. It's still a mystery. How do prions cause CJD? Prions cause CJD by misfolding. They go from the normal cellular prion proteins, the PRPCs, to the PRPSCs, which are the misfolded version. And as we know, structure of proteins equals the function of the protein. So if it isn't properly folded, it's not going to have the proper function. The structure of the prions aren't fully understood either, but it is believed that the infectious prions have more beta sheets than they do alpha helices. As you see the picture to the right, the normal prion protein has about 40% alpha helices compared to the 3% beta sheets, but then the infectious prion, the PRPSC, has 30% alpha helices and 40% beta sheets. And what the misfolded prions end up doing to your brain is they cause it to shrink, and the tissues of your brain will start to fill with these little holes, and in the end your brain will just look like a sponge, just a mess. How do prions replicate? As with everything else, the replication of prions isn't fully understood. It is believed to spread from cell-to-cell contact and is reliant on cell proximity and direct contact to do this. So the closer the normal prion proteins are to the infected, the more likely they are to get infected. It is also believed that for the normal prions to be converted, it must be in the plasma membrane because the infected prions are rarely seen on the cell surface. CJD symptoms. This disease is always fatal. Most people who contract CJD will often die within a year of being diagnosed. The average person will live around 6 to 7 months before passing away. A common symptom is memory loss, problems with coordination and insomnia, and then some people even have muscle stiffness and vision problems. CJD transmission. CJD can be transmitted sporadically. It can develop for literally no reason at all. You can be sitting there minding your own business, and then all of a sudden you start having symptoms. It can come from inheritance, so you can inherit it from your father or your mother. And it can also come from contamination from things like medical procedures or eating contaminated beef from cattle. Sporadic CJD. Sporadic CJD is the most common case of CJD. It's around 85 to 90% of the cases worldwide. There is no known reason why it happens. It literally just occurs randomly. You can also call it spontaneous. And it is believed that sporadic is a result from a genetic mutation that just occurs in your body at a random time. Inherited CJD. Inherited CJD is you inheriting the CJD gene from one of your parents. So if one of your parents have the gene, there is a 50% chance that you do as well. Two inherited forms include Gerstmann-Straussler-Schenker or GSS syndrome, or fatal familial insomnia. GSS syndrome. GSS syndrome is less common than normal CJD. It is about 100-fold less common, and it only affects a small amount of families all over the world. I believe it was around 10 to 11 families per year that it affects. It can lead to problems with coordination and thought process, as well as cognitive impairment, visual impairment, and difficulty swallowing. Fatal familial insomnia. Fatal familial insomnia results in not being able to sleep. It can lead to irritability, depression, anxiety, basically a bunch of mental issues. It can lead to fatigue, where you're always tired because you're not able to rest, and it can lead to cardiovascular problems. And the cardiovascular problems can lead to death. So not only are you suffering from an incurable disease, but now you can't even sleep. CJD from contamination. You can get CJD from touching infected tissue. So for example, if you're a surgeon and you're operating on a patient, and say you have a tear in the glove that you're using and you touch the patient, there is a chance that you have contracted CJD. You can also get it from medical equipment. So if the hospital isn't properly sanitizing or is cross-contaminating a bunch of other medical instruments, then it's possible that a patient can develop CJD. You can also get it from contaminated beef. This is mad cow disease. Mad cow disease is also a result from misfolded prions. This causes abnormal behavior, difficulty walking, and weight loss, which will eventually lead to death in cattle. So if you eat an infected cattle, you're intaking those misfolded prions. And CJD is essentially the human variant of mad cow disease. People typically use the terms interchangeably, where CJD is in humans, mad cow disease is in cattle. CJD prevention. There's not a lot known about preventing CJD, and as for sporadic CJD, there is no known prevention. There have been experiments where researchers have impaired the transport of the normal prion proteins to the cell membrane, and this effectively cured the cell, because if you remember back in the beginning of the slides, the infected PRPSC proteins are mainly found in the cell membrane. So if you stop the transport of the normal proteins to the cell membrane, the infected ones won't be able to infect the normal ones. If you are operating on someone with CJD, make sure to clean up properly and make sure to properly use medical equipment and to not cross-contaminate between two people. Only get beef from a trusted source, and if there happens to be a mad cow disease outbreak in the area where you normally get your beef, it's probably a good idea to stop buying beef from there for a long time. And as for treatment for CJD, it is an incurable disease, so the only treatment you can really get is therapy treatment for your mental stability. All right, this is the end of my presentation, and I thank you for your time.